Welcome back. Well, yes, we're going to get some update from two gentlemen joining us this morning. Dr. Sani Aliyu is the National Coordinator, Presidential Task Force on COVID-19. He joins us via Skype. And then we also have Professor Onyi Wabara, who is a professor of toxicology, chemistry, and microbiology. He's a head Department of Biomedical Sciences, now University. Good morning, gentlemen. Thank you for joining us today. Well, Dr. Ali, let me start with you. That extension, could you shed a little more light on that? We know that, yes, the president did say in light of the new surge. Does that mean that there's an estimation that probably by March, perhaps in addition to us hopefully getting the vaccine, that by March, this should have been reduced to the barest minimum, COVID-19, that is?
Well, we hope it's not going to take up to March. We have a very good idea of why the numbers have certainly gone up. What's the difference between the end of October, early November, and now? The difference, really, the main difference is the change in people's behavior over a period of time. We are now having a situation where massive gatherings are taking place with people not wearing face masks at all, not observing physical distancing, practically inviting coronavirus to infect them. And this is why the numbers have been going up. It's really a case of people no longer taking serious consideration of their own safety when it comes to coronavirus infection. We hope that over the next few weeks, as we implement some of the measures that we've already stated over the last 2 days, especially with the cooperation of the state governors. Yesterday, we had a meeting of the subcommittee of the Nigeria Governors Forum, and I was quite impressed with the commitment of the state governors on that meeting to implement the measures that we have recommended. We are calling it advisory, but in actual fact, it's the minimum. We're saying this is the minimum implementation measures that you can do for your state. You can do more, but you certainly shouldn't do anything less than that. We hope that we will be able to plateau in the curve and get the numbers to start coming down over the next few weeks rather than March ending. March ending is simply because it will give us enough time to make sure that not only have we brought down the curve, but also make sure that there are adequate preparations put in place for the procurement of vaccines and for the initial administration, which is going to be a huge task because logistically it will be extremely challenging. We don't have the ultra cold chain within the country that we can use at a massive scale. We would need a lot of logistics. We would also need to do a lot of risk communication because the level of social acceptance of the vaccine, in our view at the moment, is pretty low. People need to be aware of the safety of the vaccine and their efficacy. So there's still a lot of work to do, but we can say we are pleased because we were hoping that our job would have been done by the end of December, but unfortunately this isn't the situation. We were almost there by in October, late November. The number of cases has really been going up over the last few weeks. We've had a situation where some of the states, for instance, are fast running out of beds for treatment, and the message needs to go out clearly to the public. This is serious. The second wave appears to be very different to the first one, maybe because we are starting off at a much higher level. If you remember when we locked down the first time in March, April, we only had a few hundred cases then. Here we are already starting with a baseline of almost 1,000 cases a day. So we're playing catch up with the virus, and the way people are currently behaving is really not helping at all. We really need to start enforcing these non-pharmaceutical interventions, and we've made it very clear. Yes, it's a festivity season, but we need to be able to survive. We've already survived 2020 right up to the very end. It would be most unfortunate if we suddenly give up at this stage and just follow the crowd and end up being infected. It will become a personal tragedy for ourselves and our families. Let's not follow the crowd. If somebody else is not wearing a mask, do not. engage with the person. If you go into a place of worship and you're the only person wearing a face mask, carry on wearing the face mask. Don't take it off.
Yeah. This, what you are talking about now, the non-pharmaceutical interventions, I mean, the PTF has been talking about this for as far back as one can remember. And then you talked about, now you talk about the collaboration of the states and how impressed you are about their plans. The question one would want to ask is, what has changed or what will change in the attitude of the state governments, now? I think that's the question a number of people would want to ask. That what is it that we are going to be experiencing now that's going to be different from what we haven't done before, or rather, that's going to be different from what we've been doing before, which brought us to where we are now, So what's going to be different?
So a number of things are different. Back in March, April, the level of compliance was actually very good when we started. But COVID is an unusual pandemic. It doesn't have that shock factor. You don't see people bleeding to death like with Ebola, for instance, or dropping dead in the streets. If you don't work within the health system, you wouldn't actually know what is going on necessarily. There are so many people who have never met a person who's had COVID. The majority of people tend to have a mild illness. And because of the nature and the demography of our population, which is relatively young, in general, the majority tend to be asymptomatic. But both the state governors and ourselves know what is now happening with the treatment centers. I suggest you go to the treatment centers and find out for yourself. Things are serious this time around. People are coming in with quite severe infections. And I remember back in April discussing about India. And at the time, we were just marveling and saying, oh, India got away with it. What a mild disease. Look at where India is now. So things are changing, and they are changing rapidly. The state governors have realized this. Some of them have been infected. Some of them have discussed their experiences with us at the meeting. And I remember one of them saying that he wouldn't wish it on his worst enemy. If you are 50 and above, the mortality rate for COVID, if you are between 50 to 59 in Nigeria, when we looked at our data, 23% died. 23%, that's a huge figure. So what's different? What's different is that the nature of the epidemic has changed. The state governors know this. They also know that people are tired and exhausted. Behavioral change is not easy, especially if you drag it for more than 9 months in a society where social interaction is so critical. So they know that things have to be done differently. And even the acceptance of COVID-19 among the public has gradually dwindled and gone down, despite all the risk communication and the engagement with traditional rulers, etc. And then finally, unlike April, May, this time around, the federal government has actually resourced the pandemic at the state level. Virtually all the states have received money specifically for activities related to COVID-19. So they're in a much better position. But more importantly, we're saying the enforcement side needs to move on. The federal government cannot enforce face mask wearing right down to the community level. This is the responsibility of the state, and I believe they're taking it up.
We'll get to that.
Things have to change.
Yes, we'll get to those details, the functions of the state governments. But when you say that a lot of things have changed and an increasing number of people are going, catching, the virus now, as is obvious from all of the data that's been released, is this anything to do with the second wave being as a result of a new strain of the virus?
So whatever strain of the virus you have, if you congregate in your thousands without a face mask and it's coronavirus, it will spread. It doesn't matter whether it's a B117 or whatever strain it is. So I believe it is the change in behavior. If you have a B117 strain in the country and everybody is applying non-pharmaceutical interventions, people are careful, wearing face masks, etc., it will not spread. Coronavirus does not open your door and get in. Somebody else will carry it in. Neither does it fly from one person to the other. So what I'm trying to say here is, yes, we are looking at the new strain where we've already requested NCDC to immediately start the process of sending samples over to the reference laboratories for sequencing to see whether our strains have changed significantly and whether this particular strain is a problem. But it's whatever strain you have, it's the same method when it comes to prevention. So the emphasis is really on trying to get people to understand their risk perception, understand that this is different, understand that they need to protect themselves for their own personal, for not only for their own personal gain, but also to save their families the grief of losing a loved one. But certainly we're not sitting down and crossing our hands and saying, oh, we wonder whether it could be. We're already looking into this. We are monitoring quite closely, but we know what will be required to interrupt transmission. And for the moment, the best vaccine we have at the moment are these non-pharmaceutical interventions. We'll continue to work with the traditional rulers, the community leaders, etc., so that the message becomes very clear and the messenger changes to somebody who might be more acceptable in terms of getting things done. But these mass gatherings have to stop. They have to stop.
Okay, let's bring in Professor Wabara on this one. Prof, what do we know about this strain? What kind of research is going on behind the scene to give us confidence that, yes, we indeed have our finger on this one?
Good morning, Nigerians. Thank you for having me. Currently, this variant, this present strain of coronavirus, a lot of work is being done. Remember, it's just in South Africa and in the UK that this new strain has been isolated. Nobody knows the genetic makeup of this strain, if it's different from the previous one. However, as Dr. Ahmed just said, regardless of the strain, what we need to do is to take precautionary measures in order to prevent the spread of this virus. Super spread, gathering of people in places is very, very bad. It's a recipe for the spraying of this virus. So it doesn't matter the strain. What we need to do is to make sure that we take all the precautionary measures in order to protect ourselves. And treatment-wise, it's the same treatment that this is expected of this virus. This RNA virus, if they don't mutate, something is wrong. It's part of their lifestyle. So they have to. Scientists, we know all this, that definitely this virus is going to mutate. A different strain is going to come up, and regardless, treatment is still the same. And what we need to do is to make sure that individuals, from the individual households to communities, to our churches, to our mosques, or to all the places that we go, make sure we take precautionary measures in order to prevent the spread of this virus. It's deadly, and only God knows when all these things will be over. But for us to be safe, we need to do the right thing. So this virus is real, and we are hoping that with the vaccine in place, I don't know the mechanism that PTF have put in place. This virus is very, very sensitive. You have the storage of the vaccine is very critical. So I don't know the mechanism that PTF have put in place. When we receive this vaccine, how are we going to store it? And in the administration of the vaccine, people, we have to target those that have immune compromised system or the elderly, so that they get the first vaccine dose. And let me tell us this. It's not that someone has gotten the vaccine, you have been vaccinated, for that you are good to go. You remember, for example, the Pfizer vaccine, you get the second dose after 21 days. But the Moderna vaccine, you get the booster shot after 4 weeks. But it is assumed that you can get immune because the first dose gives you about 50-55% immunity. But the second dose gives you about 94-95% immunity. So you'll be protected. So what we need to do as we do that, I don't know when the vaccine should arrive in Nigeria, but until then, we need to make sure that we take all the COVID precautionary measures in order to protect ourselves.
Well, let's ask Dr. Aliyu himself. He's here to shed some light on the issues you just raised about how are we planning to, what measures have we put in place when we receive the vaccine to store and then administer. Could you go ahead, please, Dr. Aliyu?
Okay, well, thank you. So yesterday, Mr. President actually gave the PTF the mandate to proceed with preparations with regards to the vaccine. Just to make it very clear, when the PTF was inaugurated back in March, there was no vaccine available for coronavirus. But nevertheless, we have continued to work with the Federal Ministry of Health and the Primary Healthcare Development Agency. The NPHCDA has a lot of experience of delivering vaccines across the country. They were involved with the polio outbreak, with the polio vaccination, and even at the moment, they are responsible for the delivery of routine childhood vaccinations across the country. So they have a lot of experience. What is particularly challenging, as Prof said, with some of these vaccines that have come out for coronavirus has to do with the method of storage. It's ultra cold chain storage, where you have to store them at minus 70 degrees and transport them around the country before you're able to use them. So, but there are other vaccines that do not require such extremely low temperatures. So, for instance, the Oxford AstraZeneca vaccine requires, I think, between 2 to 8 degrees, which is the sort of temperature that we currently use. What as a country we are doing now is a lot of work is going on behind the scene. The NPHCDA have a committee. The minister himself has set up an expert advisory committee, and the PTF is now coming in to make sure that we coordinate effectively. And we have been linking up with the National Assembly as well. We were hoping that funds will be put up within the 2021 budget for the COVID-19 vaccine program, but we understand that it's a bit too late for that, and we have to go for a specific supplementary budget. We had a meeting a few days ago with the National Assembly leadership. So everybody is on board, and Mr. President has also given us the marching orders now. The COVID-19 vaccine will be available in Nigeria, making use of the Gavi arrangement. We already have assurance that we will have 20% of our population accommodated by Gavi with regards to the vaccine. We don't need to pay for that, so about 40 million Nigerians or so, but we have to pay for the operations and the logistics associated with it. We are also planning to pay for an additional 20 to 40%. In general, over the next 2 years, we need at least 70% of the population vaccinated before we can actually be sure that we have enough herd immunity. But just to make it clear to the general public, even if we had the vaccine available tomorrow in Nigeria, this epidemic will not change unless we apply the protective measures that we have been advising right from the beginning. The vaccine alone will not change it. If you look at the time period required for the vaccine to take effect, if you look at the Pfizer vaccine, for instance, the first dose, as Prof said, it takes about 12 days for you to have an undetectable antibody response. The second dose, after the second dose, it takes about a week. So in overall, it takes more than a month for one to have adequate immunity with the vaccine.
Okay.
And the Pfizer vaccines are one of the most effective at the moment.
Let me just
what's going on, but we will continue to update the public.
Okay, I just want to get some quick clarifications on some of the things you said. So, is it that these vaccines will be administered free, for all eventually? Because you talk about 28, 70%. Okay, then in the meeting you had with the president of the Senate, I think we heard him say that he thought that there will be, there may be need for us to hold on a little bit about getting the vaccine, develop the infrastructure, the health infrastructure here, so that when we receive it, we'll have the capacity or capability to then go ahead and administer. And then we heard the president say, look, use existing infrastructure to receive the vaccine. So where are we on this?
So the president didn't say use existing infrastructure. The president said use existing health agencies that have been involved with vaccination and the infrastructure that is in place. But he didn't say do not develop the infrastructure or do not renovate the infrastructure. The Senate president was right. When you have a large-scale exercise like this, where are you going to keep the vaccine? Are you going to keep them in normal fridges if they require minus 70? So definitely you need to upgrade the infrastructure. And what we are planning to do at the moment is to engage closely with primary healthcare. There will be a need to have at least one primary healthcare facility in each local government, maybe close to a secretariat, for instance, that's designated as a vaccine center, where the vaccines will be stored there, where you have access to ultra cold chain equipment, where you'd have 24-hour.
Yeah, but Dr. Ali, pardon me to button on this one. When the president of the Senate says use existing infrastructure, and if you say the president says use existing health agencies, what infrastructure do they have? Isn't it the same thing that the president of the Senate is saying?
I'm afraid you're wrong there. What I'm trying to say is, of course, you have to renovate the infrastructure, but how soon? Immediately, the president has already given the orders. We are in the process of getting the funds, but I'm afraid you're misreading what the president said and what the Senate president meant. Overall, in total, of course, you have to upgrade infrastructure in order to carry out such a large exercise. Our primary healthcare centers at the moment, some of them don't have running water or electricity. How do you expect the vaccines to be delivered, especially vaccines that require very, very cold chain? Of course. So I wouldn't say that this is an issue at all. Both the president and the Senate president are all talking about the same thing. We need to make sure that the logistics are sorted out, but we don't need to wait. We can do everything in parallel. We don't need to wait until the infrastructure is in place before we start putting in orders, etc.
From speech,
it says there's no doubt.
I hear you, but pardon me. It says that the PTF should coordinate the process for planning and the strategy for accessing, delivery, and administration of the vaccines using the existing health structures that have worked in the past in vaccine administration. What is the difference?
Health structures are the health agencies that have been running this, essentially. And of course, we're not going to bulldoze and bring down primary healthcare centers and rebuilding them completely for vaccine. No. What we're going to do is to make sure that the storage facilities are there, the training is there for the healthcare workers, people understand, but more importantly, the public awareness side. The biggest challenge we will have with the vaccines is not going to be the logistics. No, the biggest challenge will be public acceptance of the safety of these vaccines and allowing them to be vaccinated, very similar to the challenges we had with polio before. But of course, the infrastructure has to be renovated in order to accommodate it.
Let me take it.
And
just a moment.
Both of them are talking the same thing.
Yeah, we're gradually winding down on this. Let me ask Prof, about what you have said now, and that is the issue of acceptance by the people. You've just heard Dr. Ali say that's going to be a challenge, persuading people to get vaccinated for COVID-19 would be a challenge. How much of a challenge, in your opinion, is that likely to be?
Well, it could be a challenge if the area of awareness, PTF and Ministry of Health and CDC, they have to do a very better job from what they're doing right now in educating people and creating the awareness. For example, in the U.S., during the Tuskegee project, when black men were used as guinea pig for syphilis, that mindset has not changed. It's just recently that black African Americans have started to welcome the usual or the normal health care system in the U.S. Now, coming back to Nigeria, now you have to let the people know that this vaccine is safe for you to take it. We need to have people, like what is happening all over the globe. You see celebrities, world leaders getting in the front line, taking the vaccine to create that awareness, to assure people that, yes, this vaccine is safe. And I commend the scientists. Over the years, in the production of vaccine, is something that this new platform, vaccine production technology, has improved. In that, at the molecular level, things are being done that have not been done before. Normally, before, it takes about 3 years for you to get a vaccine. But look at what has happened in the last 9 months. That is the area where molecular technology, the vaccine production, that have made tremendous progress. So what we need to do is to create an awareness. This vaccine, what it does is this. it has what we call messenger RNA in it. This messenger RNA tells your body, look, I want you to provide antibody against this virus. It's like a messenger.
All
now,
right,
when that happens, your body over time will get ready. Whenever that virus comes into your body, now the antibody that has been produced by your own body to fight this virus is specific with fighting.
Right.
Now, we have to assure the citizens that this vaccine is safe because
I think that's the
past history. Where
that's the part where we will definitely do a lot more, have a lot more communication in the days ahead. But we have to anchor at this point. Onyiwa Agbara is a professor of toxicology, chemistry, and microbiology. He's the head department of biomedical sciences, Nile University. We've also had Dr. Sani Aliyu, National Coordinator, Presidential Task Force on COVID-19. Gentlemen, we do thank you for coming on, and this is a conversation we'll look forward to having in the days ahead.